Leiomyosarcoma, LMS for short. So I usually just call it LMS now. So it's a smooth, it's a soft tissue sarcoma. And sarcomas, soft tissue sarcomas make up about 0.7% of malignancies, and about 5 to 10% of those are leiomyosarcoma. So LMS is a very rare type of cancer, and it's even a rare sarcoma. So LMS is a smooth muscle sarcoma, so it can occur on any smooth muscle anywhere in the body. So, you know, we have smooth or involuntary muscles everywhere in our body. And so my particular LMS was in my lower abdomen area. They call it retroperitoneal leiomyosarcoma. So it was in my lower abdomen, just behind my intestines. And a lot of people have uterine LMS. A lot of women will have uterine LMS. And a lot of patients will have retroperitoneal LMS. And of course, there are other sites too. So I was diagnosed June 2014, so almost 3 years ago. And, you know, it's especially difficult when you first, you know, those first couple weeks, week to 2 weeks, when you receive a diagnosis like this, you know, your immediate reaction is to go online and check things out. And you know, you can tend to be a little quite fearful, you know, when you read those things. So I think it's important to just, you know, remember to try to relax, you know, take some deep breaths and know that, you know, whatever your experience with this is going to be, that you can get through it, that you'll be okay. So it's just, you know, it's scary at first, you know, to be diagnosed with a cancer. But, you know, you certainly get an education. You learn that there are so many different types of cancer, and there are so many different types of treatments and drugs, and every patient reacts differently to the drugs that they have, that oncologists usually recommend. So my experience with it is, so I was not diagnosed until after I had surgery. So I had a lower abdominal mass that was quite large. I had a CT scan, and the radiologist thought that it was possibly a type of sarcoma. And I didn't have the diagnosis until during my surgery. So they, at the time, they thought it was uterine LMS. So they did a complete hysterectomy. They removed some lymph nodes. I had a partial colectomy. I think that's what the surgery consisted of. And then after the surgery, I began chemotherapy, and that lasted, the first time I had chemotherapy, it lasted about 6 months, and it was with gemcitabine and Taxotere, which are 2 drugs used together that probably most oncologists use in treating LMS. And so I went through that, and then I have CT scans every 3 months, and I have had since my diagnosis. I've had CAT scans every 3 months. And then I just kept having scans every 3 months, and then they discovered that I had some metastases in my liver and I think 7 different bone sites. So then they tried radiation on my liver, and that really didn't, we didn't really have any results with that. And then I went on an oral drug, an oral chemo drug, and that caused me to have really bad headaches. And that it was determined that that really wasn't working too well. And just, you know, another thing too, you can have metastases, I've noticed or come to realize, And, you know, you can still live a long time with those METs in different sites. So then I had, let's see, fall of 2015, I had, or I'm sorry, 2016, I had another round of chemotherapy. This time with a drug called, I can't think of the name of the drug now. It'll come to me probably in about 5 minutes, but a different drug than the first time. And so this particular drug, chemo drug, did cause some slight reduction in some of the nodules, which was great news. But, you know, I feel really good, and, you know, I kind of just go from scan to scan, you know, and then after each scan I meet with my oncologist, and, you know, whatever the results of the scan were, then he can recommend treatment, or, you know, or we just, if it has shown no growth, then, you know, I just do what I've been doing. So I kind of have done some holistic things in addition to, you know, the medical field, what they offer. So, and I guess first of all, too, what I would recommend to anyone is it's very important to try to find a treatment center that treats your particular type of cancer. So I live in Southern California, and so I'm very fortunate to be able to treat at UCLA because they have a sarcoma center at UCLA. And so those oncologists meet together often. They're experts, you know, in the country. If you can treat at a sarcoma center, they have a lot more experience with your disease than, say, a regular oncologist would have. So try to find a treatment center that treats your particular type or your particular disease. I don't know, I think most diagnoses are probably, you know, over age 45, but there, you know, there have been a lot of cases that I've heard of where younger people, you know, might have them in either a smooth muscle on their arm, or on their legs. Some other sites, maybe more so than the abdominal area. My oncologists have just, their feeling is it's just genetic. And my mother's side of the family is very healthy. However, my father's side is very unhealthy. And my father passed away from colon cancer in his late 30s. So, you know, and his parents both died from different types of cancer. So, you know, they felt it was, my oncologist felt it was genetic. However, in some of the research I've done online, some of the holistic community feel that pesticides may have a contributing factor. So, and I do live right next to a commercial nursery. You know, so I don't know, that may have had some factor too. Maybe in my case, some of both. For me personally, I just felt a mass in my lower right abdomen. I didn't have any pain. So I think it might be a little unusual not to have any pain. I think most people that have LMS, you know, especially like uterine LMS, they would have some pain with it. But mine was just an abdominal mass that I felt. So I guess just you would feel it, or, you know, some patients have pain with it. And then, you know, as far as treatment, you know, LMS is very resistant to the treatments that are out there. It's resistant to chemotherapy. But I think you know, another reason to go to a sarcoma center where you have oncologists that have treated more LMS patients. You know, there's certain cocktails of chemotherapy drugs that they use together, you know, to target LMS, which has a better result. But it's really interesting because you'll have, you know, some patients will have, LMS patients will have great luck with one chemo cocktail, and another patient will have no result with it. So really a lot of it just depends on your, you know, your body chemistry too. Because some drugs will work better for some patients, and this, like, there was the oral chemotherapy drug that I was taking for a while. I didn't have much luck with it, but other LMS patients have been on it for years with a lot of success. So it depends. And then some of the holistic things that I've tried is I think it's important to eat less processed foods, if we can. Organic, there are lists of the Dirty Dozen list, that you can find online of foods that, definitely should be organic, that you should buy organic, such as strawberries, celery, apples. And then there are other produce items that aren't as important to buy organic, but I think, that would depend on availability, where you live also, or, if you're able, to have an organic garden, to help feed your body with the good organic food, if you can. And I think it's good to, avoid processed foods and avoid foods with sugar, natural sugar, some from fruits, I think is fine, but, anything with added sugar is not so good. And there are sugar alternatives that you can find. I know there's a stevia plant that's actually called a sugar plant. So you can grow that in your garden and dehydrate the leaves and use that as a sugar substitute. I use a little bit of honey sometimes, but just try to stay away the best you can from processed foods, and try to eat organic as much as you can. One thing too, when you have a cancer diagnosis, is you'll have a lot of people, that will want to give you things or tell you about, a certain treatment. Well, so-and-so, my second cousin had cancer and this cured it, There are so many different things that you could be taking. So I think it's important to just listen to your, listen to what the Spirit is telling you, or listen to what your intuition is telling you, and just do what feels right for you. You'll find a combination, whether it's, what the oncologists are telling you or what the holistic community is telling you. Just find a good balance and just do what feels right for you. As I said, when I was first diagnosed and when I had my surgery, we didn't know it was leiomyosarcoma. So I had the surgery first, and then I saw an oncologist at UCLA, a surgeon. And he said the best way to do it is to, if you think a patient has leiomyosarcoma, from a CT scan, try to get a biopsy first, because they prefer to do chemotherapy first and then surgery. So I think you have better survivability if it's done that way. But it's not the end of the world. I didn't have it done that way. But I think ideally this oncologist recommends chemotherapy first and then surgery, which is kind of hard as a patient, because you kind of feel if you have that in your body, you just want to get it out of there. But, from his experience, which is a lot of experience with LMS patients, it's best to have a biopsy for the diagnosis, then chemotherapy, then the surgery. LMS is a little different than other types of cancers too, because it doesn't travel through the lymph nodes, it travels through the blood. So if left untreated, you would just have, spots that pop up in different sites of your body. So I've had metastases to my liver and also different bones in my body. And right now I'm taking a drug called Exgeva, which is also prescribed for people that have osteoporosis. It strengthens the bone. And so I get an injection of that once a month. It just helps strengthen my bones. So, yeah, I think, when I knew it was in my bone, I was a bit concerned with that, and I asked my oncologist, well, does that mean that, I'm going to, start breaking bones? My bones are just going to start breaking. And he said, no, usually what happens is you'll just start feeling pain in those sites. And, there's pain medication to treat that. And I just recently got a magazine from UCLA that talked about using radiation to treat pain when you have metastases to the bone, that they can use radiation now to treat that pain. So I think it would just be, pain management, and then it would evolve into, palliative care, just helping you feel comfortable. And then that would move into hospice care. Mm-hmm. But I think, my father passed away in the mid-70s from cancer, from colon cancer. So his experience with pain and cancer was so much more difficult than it is now. Even through palliative and end-of-life care, I think patients are much more comfortable now than they were back then. Well, I think just, physically being there, because you're going to have a lot of appointments and, sometimes a lot of travel. Like when I travel to UCLA, it takes me an hour and a half to 2 hours each way, to get there. So, just having a good support system, whether it be family, church members, community, friends, that can help you. Just being there, and I also think too, for me, it's important to have someone that I can talk to, so that I can talk about, what may come that's not so great. Like, I'd like to be able to talk to someone about my feelings about, planning my memorial service, or, I know, well, as an example, this is a perfect example. So my husband, I think he's coming around, but, in his mind, when I talk, when I would bring up, well, maybe we should, find a cemetery in the area, where we would like to be buried, when we pass away. To him, it was kind of like I was giving up in a way, because I wanted to go look at a cemetery. But from my perspective, it's like, no, I'm not giving up at all. I just want to be prepared. So I like to say, I like to plan for the worst, but pray and hope for the best, and stay positive. I feel like I'm a pretty positive person, but I just would like to have all those things in place, so that my family doesn't have to worry about it, if I pass away. So and he's coming around where he'll talk to me more about those things, where before, it was like, no, I don't want to, I don't want to talk about that. Are you giving up because you want to talk about a cemetery now? It's like, no, I'm not giving up. I just want to be prepared, and I don't want to have, for you to have to worry about it, If I pass away, I don't want you to have to worry about it. So, I think just whatever we as a patient need to talk about, even though it may be hard, like I know it's really hard for my husband to talk about those things, but he's coming around. So I think whatever we need to talk about, let us talk about it. And, well, I know the first time, I lost my hair from my first round of chemotherapy, I don't know what it is, especially for women, it can be really difficult to lose your hair, and then to have your head shaved. So my daughter was a great support in that, because she shaved my head for me, and, but, I think we worry about those things maybe more as women. But the more I was around those that loved me, and can feel that, that didn't matter, one bit to them that I didn't have hair, and I wore the little chemo beanies that didn't matter at all, then I was less worrisome about it. So, some of the things that, meant the most to me was, having someone to talk to no matter what I wanted to talk about. you know, the little, you know, flowers left on the doorstep, you know, just knowing that people care. Because sometimes, especially when you're going through chemotherapy, it you know, it can last 6 months, and then it takes a few more months after to recover, you know, from that, and you're just not feeling yourself. Just letting us know that we're not forgotten, you know, that you're still praying for us, you're still thinking of us. It means a lot. You know, I think probably most LMS patients, their survivability is, you know, 3 to 10 years maybe. And I think it's an exception for someone to survive, you know, beyond that with LMS. It's not really a curable cancer right now. You know, but so much just depends on your body. I mean, I've talked to some LMS patients that have, you know, that were diagnosed 20 years ago, and they're still doing fine. So it's just, it's not as, it's not curable right now. You know, other cancers are curable. You don't really go into remission with LMS. I think you just kind of learn to live with it. And, you know, just, you know, how your body reacts to different treatments. It's just, you know, it's just very different. Every patient is so very different from the other patients that have it. I don't really know that it would be that different from any other type of cancer, you know, that's progressed to that point. I'm sure organ function, you know, would be a major involvement. I know years ago malnutrition, you know, was a factor. But I don't know that that's really the reason now, these days.
You mentioned how you ran into like a couple people who have made it past the 10 years. Like, just anecdotally from those people, what do you feel like they've done differently? Like, is there certain things that they've done with the way they live their life, maybe a little differently, that you think could potentially play a role in how well their body is able to cope with and survive? And yeah, any just like thoughts or impressions related to that topic of like those people and what they seem to maybe do differently, or how they approach their LMS maybe differently, or if they don't do anything differently and it's just kind of luck of the draw a little bit?
Yeah, I kind of feel like it's more luck of the draw, but I do know for sure that those people have, you know, done their best to maintain, you know, a positive outlook, and to, you know, never stop looking for options. Even if your oncologist, you know, feels that he's done all that he can do for you, you know, try to find another oncology team that will, you know, help you with more treatment or whatever. Just a positive attitude, you know, is everything. Having faith or hope, you know, in the future. I think it's also important to be able to, you know, just try not to be so stressed about it. You know, try to find ways that you can relax and be calm. I think that's important. But other than that, I think it is just kind of luck, you know, luck of the draw. But those patients that I've talked to that have lived with LMS for a long time, they're very positive, very hopeful people. There should be like a foundation, like I know there's an leiomyosarcoma foundation that I, you know, get their emails all the time, and they talk about different treatments and, you know, state-of-the-art research that's being done for treatments for LMS. And that's good to be plugged in with those types of foundations and organizations. And your oncologist should be able to put you in touch with some of those organizations. And, you know, the Facebook groups can be good, but they can also be kind of negative sometimes. So, you know, like it's a good place to find out, though, you know, like I have to go on this drug. How have you taken this drug, and how have you done with it? So it's a great place to get advice. But there can be a lot of negativity on those sites, so just be careful there. Be careful in that regard. And so when I met with the Integrative Oncology Department at UCLA, and that was very helpful, meeting with and I would say any sarcoma program should have or any hospital or cancer hospital should have a integrative oncology department. Well, I think it's important to just, look at things that you've always loved to do in your life, whether it's being, hiking, getting out in nature, just try to continue. Well, this is probably the most important time in your life when you're going to need some me time, just so you can rejuvenate, nurture your soul, so to speak. So just make sure that you take time to do that. Just, whatever really comforts you. You want to make sure that you're just not constantly giving to others. I know sometimes people are very giving and they're all about serving others, but also it's important to make sure that now that you have this diagnosis, you take care of yourself and nurture yourself and let others serve you a little bit just for this time. It's okay. One thing that I've learned is, sometimes people will say the wrong thing. I know sometimes people will, when they know that I have cancer, they'll come up and, oh, I'm so sorry, my aunt died from colon cancer, 5 years ago. And then you'll have someone else come up and say, I'm so sorry, my great aunt passed away from this, and sometimes it's like, I don't really want to hear about that right now, how many people have died from cancer. So what I've tried to do, you just have to be very forgiving, and you have to try to realize people are going to say the wrong thing. They're just trying their best to comfort you and help you, but sometimes they're going to say the wrong thing and it's going to do the opposite. You're going to feel the opposite effect. But just know that their comments come from love and they're just trying to help you, and just let it go. And another thing too, like if you're going through treatment or something, just if you're having physical problems, just contact your oncologist right away. Like I know the first chemotherapy I went through, I had more trouble with nausea, and so I was taking two different prescriptions for nausea, kind of in tandem, and they really weren't working totally for me. So then, I contacted my oncologist, and then he said, okay, well, there's another anti-nausea drug that we can try, and we tried that, and it worked better. So just try not to just put up with things or try to endure things if you're having pain or an issue. Let your oncologist know, and there's probably something different that you can try for it. And also, I've really realized that, you can do hard things. I mean, you can do this. You got this. You can go through chemotherapy and come out the other side. So I think we can really do hard things. And, I know for me personally, probably my faith and family has helped me absolutely hands down more than anything else. So if you are a person of faith, hang on to that and, ask Heavenly Father or God to bless you, because He will. And, during this whole process, look for those little blessings or little miracles, because they're there all along the journey. And if you just keep your eyes open and look for them, you'll realize that, like I realize all the time, that my Heavenly Father is there for me. And sorry, I wasn't expecting this. But He'll help you through. He'll help you do hard things, no matter what have to do. No matter what you have to do to get through it, He'll help you. And if you don't have a faith, you know, as I mentioned, just do those things that bring you peace. If it's being out in nature, you know, just go. If you're able to live, if you're fortunate enough to live near a beach or a lake or where you can hear water running, you know, that's very peaceful. So just go, you know, just try to rejuvenate your spirit as much as you can. And remember, you can do hard things and stay hopeful, you know, never give up. One thing I'll mention, which was really sweet and it really meant a lot to me, is I have a neighbor, a good Christian neighbor friend, and she invited me to go with her to her, I think once a month her church has a prayer group. And so I went with her to that, and it was just really sweet. And, you know, just, I mean, even if you don't have a faith, ask others to pray for you, because I think that's really where we get this strength and grace that we need to get through, you know, trials like this.